Hi, my name is Eva with Eva Therapeutic Wellbeing, and I'm here today to teach you tips and tricks on liver mobilization and liver function. So let's get started. I'm going to scoot back on my mat, and I'm going to show you my favorite tips and tricks for having a healthy liver. So the supplies that you're going to need today to join me, and we can make modifications, but my best suggestions for sure is having a tennis ball. So if you have one around, if you don't have a tennis ball, you could try using a golf ball, or you could try using like one of your kids' small balls, but a softer ball like a tennis ball really works a lot better. So definitely having a tennis ball. If you have a yoga block, a softer one would be better. But if you have a harder yoga block, you can definitely work with that. And then if you have a foam roller or even a rolled up towel, would be awesome to have on hand. And all of these things are going to help you with all of the tips that I'm going to give you today. So those are the supplies that you're going to need. My favorite way to help with the liver is starting your day with a hot cup of lemon water. Lemon water really helps, especially if it's the first thing you have in the morning. It helps to filtrate your liver, filtrate your lymphatic system, and it's just a great way to start your day. Most people start their day with putting coffee in their body, but you'll really notice a huge difference if you add water with lemon in your body every day on an empty stomach. So that's my first tip is hot water with lemon. So definitely make sure you have that on hand as we work today. So let's just start by talking a little bit about where the liver and the digestive system is located. So the first thing that you need to know is the liver is one of the largest organs, and it's located underneath the right rib cage. So the liver actually goes from underneath your left nipple line all the way across and around your body, all the way to the back side. So it takes up an enormous space, but it's mostly located underneath the right rib cage. So a lot of times people will complain of stiffness, pain underneath their right nipple line. That is a sign of like gallbladder congestion, which is also related to the liver. And also right shoulder, anterior shoulder position. So when the liver is tight and compressed, it can cause the right shoulder to roll forward. So if you notice that you have a lot of shoulder pain on the right side, it could be correlated to the liver. So that's the location of the liver. If you have a congested liver, the common pain pattern that people demonstrate, or if you have migraines, this is the typical pattern. You'll have pain right back here along just underneath the shoulder blade. If you have pain in this location, this can definitely be a sign that you have gallbladder or liver congestion. So you'll have pain almost like it feels like someone's pushing a screwdriver into your back. That shooting pain will go up to the shoulder area here and into the neck, and that sometimes will even shoot pain into your eye. You can also have some anterior neck pain as well, up underneath the chin. Some people also demonstrate some pain on the left side, but it's much more common to have pain on the right side. So as we do these techniques today, you're going to notice that your neck might feel more freed up and your shoulder might feel more freed up. So that's our location. Let's also find the location of our digestive system. So what I want you to do is find your right hip area. So right at your hip bone, there's a major valve here called the ileocecal valve. The ileocecal valve is the main valve that's significantly important for moving our whole bowel system. So in your right lower quadrant, right at your hip, I want you to press in that area just gently, and I want you to move your hands clockwise and move that area. That will help to stimulate the ileocecal valve and open that. As we move things out of your liver today, we want to make sure that your digestive system is very open so that if we push out stagnant blood, if we push out stagnant bile, that has a place to go. We need to have your digestive system moving in order to push out those toxins today. So in your right lower quadrant, you want to stimulate your ileocecal valve. And then right at your belly button on either side, let's just do a few of those to get that area nice and open. So in that right hip, I'm not sure if this is backwards to you or if it's the same direction for you, but I'm going to really emphasize what side I'm doing this on. So right lower quadrant, right in that hip crease. Now you could do this laying down if you wanted to. If it would be more comfortable for you to lay down, you might be able to open up your abdomen a little bit better if your right lower quadrant, is nice and open. So feel comfortable if you want to lay down, you can totally do that, but I'm going to stay sitting up just for this video so you can see what I'm doing. So stimulate the right lower quadrant, and then we're going to come up to the belly button. There's also 2 digestive valves on either side of the belly button. On the right side is the sphincter of Oddi, which is what drains the hepatic duct from the liver and the gallbladder down into the duodenum, which is the beginning of the digestive system. So what you're going to want to do is rub that. We're talking about just directly on the right side of the belly button. You're going to stimulate that also in a clockwise position. So we're just going to do a few of those. You might hear some gurgling of your digestive tract, which is actually really good. We want that. That means we're moving things. All right, now we're going to go to the left side of the belly button, and we're going to do the same thing. Circular motions to open up that part of your digestive tract. And that's just going to get the digestive system moving. All right, and now what we're going to do is we're going to start at the right part of your colon, and we're going to actually go up the body, up towards the liver, across the abdomen, the top of the abdomen. This is just going to stimulate your colon, and then down the left side of your body. We're just going to do that a couple times. Up the right side, across the abdomen, and down to the left hip. One more time. And you can, if you would like to do this a couple more times, you totally can do that. Take the time to do that. Hopefully, if you watch this video a couple of times, you can kind of develop your own sequence. And this is just moving, getting the colon moving. So we're just stimulating all of those organs. Good. Okay, now that we have everything stimulated, we also need to get our nerves stimulated. So one of the things I like to teach my clients is parasympathetic breathing. Now the vagus nerve runs from our brain all the way down through our neck and into all of our digestive organs. And doing some parasympathetic breathing will help to get everything stimulated and moving as well. So we kind of did some touch stimulation. Now we're going to do some breath stimulation. And I'm going to show you 2 breathing techniques to help stimulate your vagal nerve, okay? So the first one is a parasympathetic breathing technique. You're going to breathe in for a count of 3. So you're going to do inhale, 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 and then we're going to hold for a count of 4, and then we're going to exhale. Let's try at least 3 rounds so you can get an idea of the parasympathetic breathing, okay? So inhale, inhale, inhale. Hold and release. Push all the air out of your lungs. And again, inhale, inhale, inhale. Relax your shoulders. And release. Inhale, inhale, inhale. Hold. And release. I would suggest doing at least 10 rounds of that parasympathetic breathing. And if you are having organ problems, constipation, liver issues, and just everyone in general, doing that type of a breath work every day before bed will significantly improve just your overall health, well-being, your digestive functioning, you're relaxing your brain and getting you ready for sleep, okay? So the second breathing technique I'm going to show you is you can do just some regular version, or you can do a more advanced version. What we're really working on is trying to open up the liver right through here, okay? So what we're gonna do is we're gonna do an inhale, open, and then exhale, bringing in your belly button and drawing in your rib cage. So what we're doing is we're actually articulating the liver through the abdominal cavity, trying to open up some space. Sometimes when our liver gets congested, it gets pushed up underneath our rib cage and gets stuck right at the diaphragm. And signs of this you might feel, you might have breath, like feeling like you can't take in a deep enough breath. Or if you run or jog, you might commonly get a side ache underneath your right side. So if you want to do the more advanced version, you're going to inhale like this, really bending through the back, if you can see here. And then exhale, drawing your navel in and pulling your liver up underneath your rib cage. Inhale up, hold, exhale down. Breathing in and relaxing down. Show your forward view. Breathing in, hold, breathing out. Breathing in and breathing out. Also doing 10 of those breaths would be really beneficial to help move those organs and get your liver unstuck. Okay, so now that we've done the breathing and we've got our digestive system moving around, I'm going to start showing you some liver thumping. This is a great way to wake up the organ and just increase the energy to that area. It also will stimulate the hepatic ducts and the draining system of your liver, the lymphatic around your liver, and just overall general wake up this organ. Okay, so you can do liver thumping a couple different ways. You can use the sides of your hand and gently kind of drum around your liver, or you can use your fingers kind of like a light poking in towards your liver. Okay, so let's just do a little bit of the liver thumping. And don't forget the backside of your liver too. So make sure you're just doing some light tapping around that whole organ. And that actually feels really good. And this isn't something that people think about doing. So you can do some percussion, some alternating, like alternating the two hands, tapping. And if you feel kind of some sore spots, you can focus on that area. I know I always have tenderness kind of where my gallbladder is. And you could also be doing the breathing along with this. So don't forget your breath and don't forget to breathe in as you do this. And don't forget that backside. So you could spend a couple minutes doing this every day. You could also do this in the shower to save some time, just to wake up your body. A lot of people who are living liver congestion, they wake up between 1 and 3 in the morning. So another tip that I like to give people is eating a tablespoon of honey before bed. Your liver needs a glucagon store to help to clear toxins and work really well during that time. So if you're waking up between 1 and 3, definitely doing some of these techniques will help, and doing a tablespoon of honey before bed will really help give that liver the energy that it needs to help clear toxins during that time. So if you're waking up like with a hot flash during that time, or needing to go to the bathroom, or if your mind is racing or wired, those are signs that, and if you're always waking up at that time, those are signs that your liver definitely needs some help. Okay, now that we've done the liver tapping, I'm going to show you stimulating the liver meridian. So right underneath both of your nipple line on both sides, you can stroke downward. We're going to do this 10 times. 2, 3, 4, 5, 6, 7, 8, 9, 10. And also we're going to stimulate the liver ditch, which is in the right thigh region. So if you go from the inner your inner thigh from your right knee up into your groin. That is the liver ditch. This area is really, really sensitive, especially if you have a congested liver. So what we're going to do is just stimulate the inner thigh, and you can do downward strokes. You can do back and forth. This just helps to stimulate that liver meridian. And if you notice that there are some sore spots, you can spend a little bit more time for those areas. Probably a lot of people don't even realize that this is sore on them. And this has to do with that liver meridian. We're just going to do 10 strokes of that. And you can come back and do, if you practice Qigong, this is very common in a Qigong practice. I like to take my favorite things from all areas: Qigong, yoga, Chinese medicine, visceral. I like to combine all of it together. They're all great techniques. Okay. The next thing we're going to do is a child's pose to stretch the right and the left side body. When we do this position, what we're actually going to be doing is compressing the liver and opening the liver by doing this position. So find a comfortable spot on your mat. I'm going to start on this side here. So what you're going to want to do with the child's pose is you can do a wide-legged child's pose if you want more of a stretch of your hips, or if that's not comfortable for you, you can do a child's pose just with your knees together. So if you want a more advanced stretch, you can do the open child's pose, okay? So what you're going to want to do is you're going to focus on opening the right side body, okay? So what we're going to do is we're going to stretch out on our mat here. And what you're going to want to do is angle both of your hands to the left side of your mat. And then you're going to want to gently push your right hip out towards the right side of your mat. And we're really just getting a nice stretch. You're going to feel a stretch all along the scapula and all around the right side body. Nice stretch. Now, when you're in this position, it's really also important to use your breath to open up your rib cage, because this is where the liver has a tendency to get stuck. So let's do some breaths in this position. You can do your parasympathetic breathing that we just went over. Hold breathing in, breathe, 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 and hold. And relax. And you can see as you do the breath, how much more that intensifies that stretch. Let's do it again. Inhale, inhale, inhale. Hold. And release. One more time. Inhale, inhale, inhale. Really stretch, push that right hip out towards the right side of your mat. And really stretch that side body. And relax. Now you could do this more begin style. You could hold that position for up to 5 minutes and really work on opening up that side body. Now let's work on the opposite side, because what we're going to want to do then is work the liver in the opposite direction. We worked on opening it. Now we're going to work on opening the opposite side. So same thing. Hopefully you can see me okay. Actually, I think I'm going to switch around. So we're just going to do the same thing. We're going to bring your left side to the opposite side of your mat, to the right side. So you're going to bring your left hand to the right side of your mat. And now we're opening up the stomach side of the body, and we're compressing down the liver on the right side. So you might notice that this side is a lot less tense. It is for me. My right side, my right meridian of my liver is really, really tight. And the left side, like my stomach meridian, is definitely not tight. So I notice a huge difference between the side to side, and you might notice that too. So again, child's pose, you could do a wide-legged pose, or you could do your feet together. I'm going to do a wide-legged pose. We're going to bring our arms out, slide our arms out to the right side and really stretch that left side body. Push out your left hip to the left side of the mat. And breathe in. Inhale, inhale, inhale. Hold. And release. And again, inhale, inhale, inhale. Hold. And release. One more time. Inhale, 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 and hold. And release. You can come into just a regular child's pose if you'd like. You can wiggle your hips side to side. That kind of compresses the liver, gets the liver moving from the back side or the underneath side, front side. And then come into a tabletop position. All right, so what we're gonna do, actually I'm gonna switch back so you can see my right side. What we're gonna do is we're gonna do a cat-cow, and we're gonna really work on bringing the liver down and then pulling the liver up, okay? So this is gonna help mobilize the liver in this kind of a pattern, okay? So it's just another way to free up that liver. Okay, so we're going to do a couple cat-cows. So you're going to take a breath in and drop your belly. And when you breathe out, really work on pulling that navel up towards your spine and rotating your abdomen up along that liver line. Really push up through there. And breathe in. Drop that belly. And breathe out. Really push through this area. And breathe in. And blow out. You could do 10 or so rounds of that if you'd like. And that just really helps to free a more free position of the liver. And we're working the liver in all the different directions, if you can tell. The liver moves in 4 different directions. So we're trying to work on getting the liver to move in all of those movement patterns. Okay, the next one we're going to do is a spinal twist. And we're going to do this also in both directions. So we're squeezing the liver. This is more of a way to squeeze out the organs. So we're going to work on squeezing not only the digestive tract, the liver, but also the stomach. We're going to do this in both directions, okay? So the first thing you're going to do is lay back on your mat. And then what you're going to want to do is bring your legs down to the side. We're first going to drop our legs down to the left side. If you can tuck your knees up as high as you can, that's going to give you more squeeze, okay? And then you're going to want to bring the opposite arm. So you're going to bring your right arm, your legs are down to your left, and your arm goes down towards the right. Your right arm goes down to the right. And we're going to do a full twist. And make sure with this position that you're breathing into that right side body or the right liver. Breathing in. See how that makes it so much more difficult when you have to do the deep inhales? That's really going to move your liver. Breathe in. Hold. And breathing out. Breathing in. And breathing out. Breathing in. Breathing out. Now, if you're not able to bring your legs up this far, you can drop them down, or you can even do a modified where you just do one leg if that's more comfortable for you. You can do whatever is easier for your body. Definitely you want to make sure that your body feels comfortable. You don't want to push your body too much to where you're feeling pain. So definitely listen to your body. Okay, now we're going to do the opposite side. So you're going to bring your legs now down towards the right side. Really tuck those legs up. And you're going to bring your left arm down. Again, really trying to emphasize getting that left shoulder down to the ground. All right, now we're going to breathe into our left side body. Breathing in. And hold. Breathing in. And hold. And relax. Breathing in. And hold. And relax. Again, you might start hear some gurgling noises. Those are really all good signs that we're getting your liver and your digestive system moving. Now, you can also use all of these strategies for your digestive tract as well. So if you're having some constipation or some gas or bloating, all of these activities are going to help with that too. Okay, so the next thing we're going to do is an open chest breathing technique. So if you have a yoga block, a pillow, you could use a rolled up towel, anything really would do. A yoga block, honestly, like this would be the best. So what we're going to do is we're going to position this back behind our back. You want the block to be kind of right at your thoracic spine or at the bottom of your bra line. And what we're going to do is we're going to open up our body here. You can have your legs out straight. But what we want to do is open up the thoracic spine. So what we're really going to do is bring our heads back nice and relaxed. Now, if you can't bring your head back and you need a pillow to support your head, feel free to do that. Okay, I'm actually going to adjust this down just a little bit more. Okay, so right underneath the bra line. Okay, so for a more advanced version, you can bring your arms up over your head, or you can just bring your arms out like a butterfly position too. This is going to be a more advanced version. If you're unable to do that, you can just rest your arms on your abdomen. Same thing. We're going to focus on the breath, okay? This is a position that you could do for a long period of time. You could do this up to 10, 15 minutes if you wanted to. You could bring your arms up to the side even if you'd like. So let's focus on that. Breathing in, hold, and breathing out. Breathing in, hold, and breathing out. Try your arms up above your head and see how that feels different to you. I really can feel a stretch on my right side body, and I really feel that pulling on that restriction inside my liver. So try that if you're able to. Breathing in and breathing out. Breathing in, breathing out. Breathing in, hold, breathing out. And I can really hear that getting my liver going. I can really hear it making a lot of noises. When you're finished with that, you can roll to the side and bring yourself up to a seated position. That's probably one of my favorite techniques. If I'm getting a headache, migraine on the right side, or some tightness, this is kind of one of my go-tos. And I'm going to show you a couple other one of my go-tos as well. And don't forget to keep drinking your water with lemon as we do this. That's just going to keep things moving through your body. All right. The next thing we're going to do is side body liver compression. This can be very intense, but it feels very, very good. Using a foam roller is going to be the most intense. Using a rolled up towel, or if you have one of these yoga blocks, this is going to be less intense. I'm going to show you with the foam roller because I get more of a stretch on my side body. We're going to do both sides, okay? So this is going to be what I would consider liver compression. I'm going to go down onto my right side with the foam roller, okay? And this is going to kind of squish in your liver, okay? Do you see how that angles my body and really pushes my liver in like that, okay? So we can modify this in a couple different ways. Make sure your head is nice and supported and relaxed. You can make this more intense by bringing your arm up over your head. And again, you want to make sure that you're doing your breathing. Make sure that you're not holding your breath, okay? So you can breathe in. If it isn't comfortable for you to bring your arm up over your head, you can just bring your arm wherever it feels comfortable, okay? So breathing in and hold and breathing out. Hold and breathing. You can kind of move your body back and forth. This also helps to stimulate and free up the liver. So you could do a little bit of rolling side to side. And don't forget to do your breathing. You bring your arm up and down a couple times, rotating your body, compressing that liver. You might hear your gurglings increase as we're doing this. That's great. That's great news that the gallbladder is moving, the liver is moving. Those are all really good things. All right, now we're going to come back up and we're going to do the opposite side. And this is more to stretch the right side body. Okay, so we're going to come over to the left side and we're going to really open up the right side body. Okay, so we're going to come down onto the left side of our body. Same thing, support your head and really kick that leg out on the right side and open up that whole right side of your body. And this really opens up that whole liver, meridian, all the fascia and viscera on the right side. And you're going to really start hearing some gurgling. Stretch out that leg. If you're not able to do that, you can bring it curled up. Breathing, make sure you're focusing on your breath. I didn't realize how hard it would be to talk and do this at the same time. This is my first time doing a video like this, so thank you for supporting me. Again, you can kind of rotate your body a little bit, getting those different areas of tension. If you can feel an area of tension, really just stay there for a few minutes until you feel it releasing. I don't know about you guys, but I can really hear my digestive system moving. And this is really, really improving the motility of my gut right now. I don't know if you can feel that too on yourself. Breathing in, make sure you're doing your breathing. Excellent. That feels really, really good. And this is going to help open up that, we don't get a lot of movement through our thoracic spine. We just do a lot of in front of a computer on our phone. And so our thoracic spine doesn't get that freed up movement that it needs to really keep our organs moving. Okay, so now that I showed you this, I love this. I love this very much. I'm going to show you my absolute favorite quick tip technique for freeing up the liver and getting the gallbladder moving. So if you have, now I'm definitely, if you have pain, anything like that, definitely seek medical treatment. This is just from my experience, the things that I give my patients to do, but I'm not giving you any medical advice or anything like that. So this is what I suggest for freeing up the liver. If you're having that pain pattern where you have this tightness here, pain in the base of your neck, or the shooting into your eye, this is one of your best bets for getting rid of that pain. Most people think they need to like massage their neck or, they take medicine, they do acupuncture, they've done massage techniques to the upper trap. But if your upper trap on the right side is always tight, this may be your bet to reducing that neck and shoulder tension. So this is what I suggest. So if you have some indigestion, if you're having some pain underneath the right rib cage, if you're having this phrenic nerve pain pattern going up your eye, as your gallbladder, if your gallbladder is congested, if you had a fatty meal, or if you've been under a lot of stress, what happens is your gallbladder will start to fill up with bile. And if remember at the beginning when I had you do the digestive stimulation, well, if you are under stress, your digestive system, it starts to lock up and shut down. And one of the things that happens is that valve that we stimulated at the very beginning, the sphincter of Oddi, it starts to tighten up. And so then the juices can't come out of the liver and the gallbladder to help break down food. And so that's why the breathing, the relaxation, the deep parasympathetic vagal stimulation is really important, because that helps to relax the nervous system to allow those sphincters and the digestive tract and the vagus nerve to stimulate those organs to move them, okay? So if you've been under a lot of stress, if you had a fatty meal, if you have indigestion and you're having kind of some pain underneath the right rib cage, underneath the right nipple line, or if you're having pain right by the right side of your belly button, those can be signs that gallbladder is not being able to eject bile properly. So this is one of my tips, okay? So first, take the tennis ball, and you could even have done this at the beginning with the tennis ball. Remember when we kind of brought our hands up and across and down? You could absolutely do that with a tennis ball and give yourself a little bit more pressure. So if you wanted to do that, you absolutely can do that. That would be something that you could do at night. If you have constipation, you could do that as a massage technique at night. But this is for migraines and if you're having indigestion. So start by doing some clockwise motions right at that duodenum. This is that sphincter of Oddi, right on the right side of your belly button. So go ahead and stimulate that area. You want to do this first. And again, the breathing in and breathing out, like I taught you, where you breathe, 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 and hold, and then breathe out. You want to make sure you're doing those. When we're in pain or we have discomfort, we have a tendency to hold our breath, and that is not our friend. So I want you to do that first, okay? And then you might notice that you have what we talked about in the beginning, that pain right in kind of this area, right by the inside of your scapula, right through here, okay? So you want to find that area where it's really tender, and then you're going to want to lay back, bring that tennis ball right underneath that spot. Now this is kind of uncomfortable, okay? So I'm just warning you. Bring your body, see how it opens up, just like we were doing that breathing technique. It opens up your liver area. But what we're actually pressing on is the phrenic nerve. So it might be really tender. So I always have people just lay there for just a little bit and just do some breathing. You might even feel pulling or tension all the way down to around your tailbone. That is part of the gallbladder meridian. You'll feel it all the way down towards your tailbone. So if you feel more comfortable, you can bring your arm up over your head, but just wait until your body relaxes into that tennis ball, because this can be really, really uncomfortable. All right, so you're just going to take some breaths, and then this is a way to help free up that phrenic nerve, okay? So you're going to do a couple different things. You're going to take your arm and you're going to use it kind of as a lever to rock. You see how that's rocking my liver up and down? So you can do 10 of these, and you're going to really start hearing your digestive system moving when you do this. So this is opening up that liver. It's rotating the liver inside that diaphragm. Go ahead and breathe with it if you can. This is also massaging that nerve pain pattern line. All right, when you're done with that, now you're going to bring your arm up and down. So now we're rotating the liver in a rotational pattern here.
You're going to reach towards your left side. And bring your arm back down towards the mat. Cross and down. Cross and down. Cross and down. You might feel some restrictions in different parts of your abdomen that you might not have even been aware of. Cross and down. Good. And you can do that really slow if you want to as well. And you can even hold all the way across your body. And relax down. Good. And maybe a couple more breaths. Really expanding through your abdomen. And whenever you're ready, you can come up off that tennis ball. That's pretty, it's pretty intense. Okay, now I want you to check your neck and I want you to see how much more loose your neck is. I should have had you test and check beforehand and after. Make sure you take some drinks of water because we're getting a lot of blood flowing and we're getting a lot of lymphatic moving and all that bile coming out of your liver. All right, now we're going to end with the same breathing and stimulating our colon again. So you could take your tennis ball now if you wanted to, and we're going to go up the right side of our body to our liver, across our transverse colon, and then down our descending colon to the left hip, back over to the right hip, up towards the liver, across the transverse colon, down the descending colon. You can spend some time there even if you want. Rubbing. Make sure you go back to your sphincter of Oddi and rub through there. And keep everything open so that everything can move through. All right, and we're going to end with our breathing technique where we had our hands over our head. We're going to take a breath in, expand, hold, and then breathe out. Curling, bringing your liver in, belly button drawing in towards your spine. Bring that navel in towards your spine, and then breathe in. Expand your rib cage, open up your heart, open up your back, kind of like a slight back bend. Really try to push your elbows back, bringing your shoulder blades together. Breathing in. Do a couple breaths here. Breathing in. Expand further each time. Pull shoulder blades together. And release. Draw your navel in towards your spine. Kind of roll your shoulders forward. Really drawing in that navel. Compressing that liver. Really compressing down through the rib cage. And again, open up. Breathing in. Do a couple breaths here, really pulling your shoulder blades back. Couple breaths, breathing in, breathing out, breathing in, breathing out, breathing in. And then breathe out and we'll pull our navel in, really compressing down that right side, drawing all your organs in, pressing them in, and relax. Well, how do you feel? Do you feel nice and loose? Is your digestive system moving? Those are just some of my great tips I like to give people that are having liver problems. Hopefully this is something that you can integrate into your daily practice, your daily routine, or maybe watching the video a few times, you can kind of come up with the routine that works the best for you. So thank you so much for joining me today. It was my pleasure. It was my pleasure working with you today. Thank you for watching my video and look forward to the next one. Thank you so much.